Ahí está.
Hello, my name is Kimberly. I am an PMHP student at UTEP, and I will be conducting an interview today. I am working under supervision, okay? Is that all right with you?
Yes.
Everything we do disclose is between me and you. Everything is confidential unless, of course, if there is something, a safety issue that you would like to address or would like for me to address. Okay, then we could go ahead and do that, but other than that, everything is confidential. Whatever you tell me stays here.
Okay. Thank you.
Of course. At times you might see me look down and I am just writing notes, okay? So I could see what the best treatment plan for you is and see how we could help you and to go forward to helping you with whatever is going on with you. Okay? Before we start, would you like something to drink?
No, I'm fine.
Okay. May I have your full name and your date of birth?
Aide
Mm-hmm.
Gonzalez.
Okay.
My birthday is May 1st, 1980.
Okay. How would you like me to address you? Do you have a nickname or do you prefer to go by another name?
Aide.
Okay. Okay, and I do want to say I'm glad you did come in and I hope you could get the help you need.
Thank you. I appreciate that.
Can you tell me what brought you in today?
Lately I've been really, feel very worried. I just feel very restless and just worried about things.
Okay. When did these symptoms first start?
Well, I noticed that a few months ago, but it's gotten worse in the past month. I think we first noticed it like 6 months ago.
Okay. When they first started, and then you said the past month, that's when they started like getting worse.
Yes.
Was there anything is there anything specific that triggers when you start feeling worried, or is there anything that worsens them?
Well, at work, every time we have a meeting, I'm worried that they're gonna tell me that I no longer have a job.
Okay. Have there been any recent changes to your medications?
I don't take medication.
You don't take anything?
No.
Are you in any therapy?
No.
Any life circumstances? Anything going on with your personal life that's causing you to feel these symptoms?
Well, the only thing that I can tell is work. Work is getting to me. Work, I'm a teacher, and recently they're cutting funding, and then I hear on the news all these cuts that they say that they're gonna be laying off thousands and thousands of teachers, and I'm just concerned that I'm gonna be one of those.
Of course, I mean I'd be worried as well.
So that's the main thing. There's changes at work. Every time we have a meeting, there's always something new and asking, and I don't know. I'm just worried.
Tell me, when did you start teaching? How long ago?
10 years ago.
Okay. Okay, so can you walk me through what symptoms you have been feeling recently, like a day-by-day basis?
Well, I get palpitations. I feel like my heart is racing. Sometimes I feel that like chest tightness, and like I feel like there's something stuck on my throat, like I can't take a deep breath. I just get very, very restless and scared and worried.
And let me tell me, how long do these episodes last?
Sometimes like 10, 15 minutes.
10 to 15 minutes. Is there anything that help you calm down? Do you like take deep breaths? Do you try to like distract yourself?
I take deep breaths, and then that usually helps me like to calm down.
Okay. Have you been feeling down, sad, or uninterested in things that you normally enjoy? No. Have you had any periods of unusual, like high energy, or is there times where you feel decreased, or any decrease in sleep, or any racing thoughts?
No.
No. Have you ever seen, heard things that others can't?
No.
Do you ever feel like someone's watching you, or that they're like following you?
No.
No. Do you find yourself worrying about different things most days?
I mean, I worry.
Every
I
day?
worry every day. I'm worried all the time.
Okay. Have you ever felt sudden fear of panic or intense fear that come out of nowhere? Like out of nowhere, you could be driving and then you just like an attack happens, an episode.
It hasn't happened like that. I mean, I don't think I panic. I just worry. I'm just worried all the time.
Okay.
I worry about the future. I worry about everything.
Do you ever feel compelled to do any rituals, as in like making sure your door is closed multiple times before going to bed, or making sure your car's locked? Any rituals?
No.
No.
Just normal. I brush my teeth, shower, and go to sleep.
Any history of traumas or problems with eating, memory loss, or feeling detached from yourself or something?
No.
Okay. Have you ever been hospitalized for any mental health concerns?
No.
Have you had any outpatient treatment?
No, this is the first time I seek help.
Okay, well, I'm glad you're here. How about any therapy? No therapies. Have you ever been prescribed medications for your mood or anxiety?
Never.
Never? And then you don't take any medications, correct?
Just a vitamin.
Vitamins.
Just a regular multivitamin.
And you take that every day?
Every
Every
morning.
morning? Have you ever had any thoughts of hurting yourself or someone else?
No.
And then you did mention you haven't had any type of therapy, correct?
No.
Have that crossed your mind?
Like getting therapy? I mean, I've thought about it in the past, but I was a little embarrassed to admit that I needed help.
Okay, so this is the first step, and I'm glad you are here again. So I'm gonna go ahead and continue with the questions.
Okay.
Any history of suicide attempts?
No.
No. And do you have any history of cutting, or do you cut?
No.
Okay, so any substance use? Do you drink any alcohol?
No.
No drugs at all, marijuana, anything like that?
No.
Okay.
I've never used drugs, and I don't smoke or drink alcohol.
Okay. Do you have any legal problems going on?
No.
No. Any history of legal problems?
I mean, I've gotten speeding tickets, but that's it.
That's it. No. Have you ever been to jail?
No.
Okay. Have you ever participated in? Okay, so since you did mention you don't drink or anything, then you've never been in rehab or anything.
No.
Okay. Does anyone in your family suffer from any mental illness?
My aunt had depression, and then my mother anxiety.
Okay. Any issues with substance or drug abuse in the family?
My dad used to be an alcoholic, but he's sober.
Any known history of suicide in your family?
No.
No. Where were you born?
I was born in Mexico.
Was there any issues like during birth? Were you preterm or?
No, as far as I know, but it was normal.
It was a regular normal
Yes.
birth. Okay.
There were no
Not
complications.
How would you describe your childhood?
I would say it was fun growing up. I used to enjoy playing outside, and I have, hanging out with friends, and just playing, being a normal kid.
Okay. Did you ever experience any type of abuse, being physical, emotional, or sexual abuse growing up or
No.
recently?
I've never had that.
Okay. What did your parents do or do for work?
My mom is a cook, and then my dad, an electrician.
Are your parents alive? Right.
They're both alive, but they're divorced. They got divorced when I was 10 years old.
Okay. And how's your relationship with your parents?
I'm very close with my mom, and well, with my dad, it became distant after the divorce. But, I mean, it's cordial. I'm okay.
Okay. So primarily, raising you was your mom?
Yes,
So,
my mom. It was just like my mom.
okay. Do you have any siblings?
I don't. I'm an only child.
Tell me about any current relationships or past relationships that you've had.
I'm not in a current relationship, and my last relationship it ended like 3 years ago. We were together like for 5 years, and we just grew apart and decided to part ways.
Okay. Have you ever been married?
No, I've never been married.
Do you have any children?
I don't have any children.
What's your highest level of education?
I finished high school and I did a few classes in college, but then I stopped going to college. I always, I would get so scared about, failing classes that I decided not to stress about that.
And for your school history from elementary, middle, and high school, was that back in Mexico? Was it here in the States?
It was here in El Paso.
Okay. Is there any like bullying throughout school?
Not that I,
No.
no.
And how did you do in school? Like your grade wise?
I did okay. I mean, I wasn't an A student, but I did, get like a B honor roll most of the time. It was fine.
And friends?
I had friends. I was a little shy, but I did have a few friends.
At what age did you graduate high school?
I was 17.
What's your favorite subject?
Reading and writing.
What would you say would be like your least subject?
Math, I definitely do not like.
Do you have any interests or hobbies?
I like to read, and I like to exercise. I like to listen to music and watch a good movie.
Okay, and those are really good coping skills. Exercise helps us release a lot of stress, brings our cortisol levels down. Okay, so I'm glad you are exercising. It's really good for not only physical but our mental health as well. Okay. Any behavioral or attention problems growing up?
No,
No.
I was very quiet and shy.
I know you did mention you have some college. You did mention you've been a teacher for the past 10 years. Before being a teacher, any other jobs you've had?
I have a coffee shop.
Okay. And then you did mention that's one of your stress, right? Correct? Being the budget or being cut off due
Yes.
to what's going on right now
Yes,
in
I'm very,
Kimberly and with the teachers.
I'm very worried about that. I did say that I got a few classes in college, but I mean, enough classes to finish my teaching degree.
Have you ever served in the military?
No.
Are you currently receiving any type of disability benefits?
No.
And then you did mention you don't have any legal issues, correct?
No legal issues. I've never had legal issues.
Do you have a religion that you have in preference?
Christianity.
Okay. And then are you currently sexually active?
I'm not in a relationship.
Are you taking any contraception?
No, I don't need to. I'm not in a relationship.
Okay. And then I know you did mention you're not in a relationship, but like sometimes they do prescribe like contraception for like and other health issues. Okay.
I'm healthy.
Okay. And then you did mention that you've never been pregnant.
I've never been pregnant.
Any difficulties or concerns related to your sexual health?
No.
No. Any chronic or past medical issues that I should be aware of? Any diabetes, any thyroid issues?
No.
No? And I do ask this because usually like if your thyroid levels are off, it could cause us to feel depressed or have any sleep issues or even feel anxious. Okay?
I haven't had my thyroid check in a long time, so I don't know.
Okay. Have you ever been hospitalized due to any medical condition?
No.
Any surgeries in the past?
No.
No broken or you've never fractured any bone?
No. Thankfully not.
You don't have any history of seizures?
No.
No. Any head trauma in the past?
I don't know if it's head trauma, but I was in a car accident like 15 years ago, and I remember hitting my head.
Okay.
And losing consciousness, being at the hospital for a few days, but that was it.
Do you feel that your worriness and all that started from the accident, or this is more recent?
No, this is recent. This is recent because of all the changes that are happening at work.
Right. Since the accident, since you did mention you hit your head, have you had any issues with headaches or migraines? Do you experience?
I mean, I get occasional headaches. I don't know if that's related to that, but not. Nothing
To worry about?
No, I've never had any issues, or I've never been told that there's something wrong in my brain.
Okay, and you don't take medications for headaches?
Just like over the counter Tylenol, and that's it.
You've never had an abortion
No, ma'am.
or any
I've
miscarriages?
never been pregnant at all.
Okay. Your last menstrual period?
It was last month. It was like March 1st.
Okay. Do you have any allergies to food, medication, or latex?
Just shrimp.
And what happens when you consume shrimp?
I get a rash, and then I get shortness of breath.
And then you did mention the only medication you are taking or supplements is your vitamins, correct?
Yes.
And you do take that in the morning?
Yes, I only take that.
Okay. And then you don't wear glasses?
No,
No. You're able to see okay?
I'm fine.
In your ears, you don't wear a hearing aid?
No, I don't wear a hearing aid. No, my ears, I can hear you clearly.
Okay.
No problems with my ears.
And then besides any occasional headaches, you're able to breathe okay, there's no deviated septum, no congestion. How about your throat?
I don't have any problems with my throat other than when I get those attacks that I feel that there's something stuck, but then it goes away.
Okay. Any cardiovascular, any heart issues like high blood pressure, tachycardia, which means your heart is always.
I mean, I get that tachycardia when I get anxious, when I feel that restlessness and that worriness, then I get like, I feel like my heart's coming out of my chest. That's
Okay.
it.
And how about any respiratory problems like asthma?
No.
Nothing like that. How's your GI? Any stomach pain? Your bowel movements are fine.
Well, when I get anxious like that, my stomach hurts and I get diarrhea, but then it goes away. I've never had any other problems.
And when was your last bowel movement?
This morning.
And your urinary, any urinary frequency, any
No.
pain?
No.
No?
No.
Infections?
No.
Okay. And then neuro, you haven't fallen in the last 3 months?
No.
No. Okay.
No problems.
How would you describe your mood today?
Nervous. I'm just nervous. No the stuff I've been through.
Are you hearing or seeing anything that others don't?
No.
Have you had any thoughts of hurting yourself or someone else?
No.
Do you need a water or
No,
you want to go ahead and continue?
Yes.
Okay. Can I ask you a few questions to check concentration and memory?
No, it's fine.
What's today's date?
Today is April 30th, 2025.
Okay. And where are we right now?
We are at your office.
Okay, I'm gonna go ahead and name 3 words, and then later on I'm gonna ask you to repeat those for me, okay? Apple, penny, car. Can you spell the world backwards for me? The word world backwards for me.
Okay, good. D L O.
Okay. If you would find an envelope that's been stamped on the floor, what would you do with that?
Pick it up and return it or put it in a mailbox.
Okay. How are apples and oranges alike?
They're fruit.
And what were those 3 words I mentioned earlier?
You said it was apple, penny, and car.
So based on what you have been, your concerns and what you have been mentioning to me, it is most likely sounds like generalized anxiety disorder. Okay. I mean, you did describe being worried most of the time, of course, due to work. You know, you did mention about how you feel tightness and like someone's like in your throat.
Yes. How do I fix it?
So it does, there's possibilities that sometimes that may look like social anxiety, or any adjustment disorders, or even panic attacks, but what you mentioned is more of like awareness, of course, of everything that's going on. I know you did mention like how can we fix this? There is a medication which is an SSRI. It's the ones that have the least side effects, and I would like to start you when it's called Lexapro. I would like to start you at 10 milligrams, and you would take that every day by mouth in the morning. And of course, the stuff I would, you might feel, not everyone, but some may feel nauseous. You might experience like a headache, or even a dry mouth. Of course, any severe side effects would be more of the what's called the serotonin syndrome, and with that I would want you to watch for any more agitation. If you feel confused, any sweating or tremors, then I would want you to please go ahead and go to the ER, and then also give us a call. But I would like to follow up with you in a week to see how you're doing. Like I said, it's a very safe medication. We usually do start our patients on this certain medication since it is more safe and with least side effects. If you agree to that.
That's okay. Yeah, that's fine. I would like to start something.
So usually for you to see any results, it's usually like 4 to 6 weeks. But of course, I want to see you back in a week if you're okay with that. So I could just see how you're doing, and then we might think of going up on the dosage, see how you're tolerating the medication.
Okay.
If you agree.
I agree with that. I think that's a good plan.
Also, I would like to refer you to therapy with one of our therapists as well. In a week from now, I want to see how you're doing on the medication, and if you were up to for therapy, let me know, and I could always put a referral. That should help with our treatment plan, okay, to help you more.
Okay.
You agree?
I do. I think it's good. I can try it.
Okay, before we wrap up, do you have any questions for me today?
Well, I know you mentioned earlier something about the thyroid.
So what I could do, I'm gonna give you a slip. I do want to see how your blood is. I want to check your thyroid levels. I want to check your liver and everything just to make sure you're safe and see if there's anything else that's of concern. Of course, if there is anything, any level, any of your labs come out off, then of course we would go from there. I could always refer you to the perfect physician.
Okay.
Yes.
I think that's good. I agree.
And then just to confirm, you did mention the anxiety started due to everything going on and the cuts and for the teachers and
Yes, ma'am.
so then I'm gonna go ahead and I am diagnosing you with a generalized anxiety disorder since you have been feeling you told me the shortness of breath, you're worried, like sometimes like you mentioned out of nowhere you just start worried. And the Lexapro should help, okay? And we'll start there. And of course, if any changes, then we could change other medications. Okay?
That works.
Again, thank you so much for coming in and for being open with me and answering the questions.
Well, thank you for listening.
Yes,
I
ma'am.
appreciate it. I look forward to seeing you again next week.